Most seniors believe routine health tests keep them safe. But new medical research reveals that some preventive checkups after 70 may actually harm more than help, leading to unnecessary procedures, anxiety, or even long-term complications. Each year, millions of older adults undergo screenings that add little value but carry significant risk. Studies show up to 37% of medical tests in seniors result in overtreatment or side effects, and nearly everyone over 70 is being overtested without realizing it. One of these checkups alone contributes to 5% of all cancer cases in the U.S., as many as alcohol does. Yet few doctors warn patients about it. So today, let's uncover the truth. The 5 health checkups you should think twice about after 70, and the science that exposes their hidden dangers. Checkup number 5, bone density scan, DEXA. A bone density or DEXA scan sounds harmless, quick, painless, and supposedly protective against fractures. But after 70, the results often cause more fear than benefit. Bone loss is a normal part of aging, yet the scan almost always reports low density, leading many older adults to be prescribed bisphosphonate drugs. These medications offer minimal benefit. A Journal of the American Geriatric Society study found only a 0.3% reduction in fractures over 5 years, but can cause serious problems, like jawbone necrosis, esophageal irritation, and brittle bones. Unless you've had frequent falls or fractures, treatment is rarely needed. Focus instead on vitamin D, strength training, and a calcium-rich diet. Studies show these natural approaches can reduce fracture risk by over 20% without side effects. Don't let a number on a screen scare you into medication that does more harm than good. Checkup number 4, brain MRI for memory loss. Forgetfulness in old age doesn't always mean dementia, yet many seniors are sent for expensive brain MRIs at the first sign of mild memory lapses. The problem? These scans almost always show abnormalities that are actually normal for aging, such as small white spots or minor shrinkage. A 2021 study in Neurology Today analyzed over 3,000 scans in adults aged 70-85. 86% showed changes, but only 3% were linked to treatable causes. The rest led to unnecessary anxiety, spinal taps, or even biopsies. One patient, 74-year-old George, became convinced he had Alzheimer's after seeing his MRI results, but his cognition was completely normal. The emotional distress, not dementia, ruined his quality of life. For mild forgetfulness, skip the MRI. A simple cognitive screening test is safer, cheaper, and more accurate for detecting early mental decline. Checkup number 3, cardiac stress test. The cardiac stress test, which monitors your heart during exercise or medication-induced stress, is one of the most overused procedures in people over 70. If you don't have classic symptoms, chest pain, shortness of breath, or reduced endurance, this test often causes more trouble than it prevents. Research shows false positives occur in up to 40% of older adults, triggering unnecessary angiograms, stent placements, and even bypass surgeries. A 2017 JAMA cardiology study found that over half of all stents placed after stress test referrals offered no improvement in lifespan or quality of life, but did increase risks of bleeding, kidney injury, and infection. A better approach? Use a resting EKG or coronary calcium scan for basic screening. Both are low risk and far more precise. Checkup number 2, colonoscopy. Colonoscopy has saved many lives, but after 70, especially past 75, the risks often outweigh the benefits. The bowel prep can cause dehydration and electrolyte imbalance, while sedation increases risks of confusion and heart rhythm issues. And the procedure itself can cause bleeding or bowel perforation. A 2019 JAMA internal medicine study of over 1.3 million seniors found that for every 1,000 colonoscopies, only 2 lives were saved, but 20 patients suffered serious complications. Even when small polyps are removed, many grow so slowly they'd never cause harm. For healthy seniors, stool-based FIT tests are a safer alternative, non-invasive, home-based, and highly effective. If you've already had clear colonoscopies in your 50s and 60s, Repeating them in your 70s is rarely necessary unless you develop new symptoms. Checkup number 1, full body CT scan. This one tops the list for danger and deception. Marketed as early cancer detection, full-body CT scans expose you to massive radiation, 10 to 20 millisieverts per scan equal to 500 chest X-rays. A 2023 JAMA Internal Medicine study estimated that these scans may now be responsible for 5% of all U.S. cancer cases, the same risk as daily alcohol use. The irony? They rarely save lives. These scans often find harmless age-related spots that spark panic, leading to more scans, more biopsies, and sometimes life-threatening complications. Marcus, an 80-year-old martial arts teacher, had a preventive CT that showed a tiny lung nodule. After multiple follow-ups and a biopsy, doctors found it was benign, but the procedure collapsed part of his lung, requiring 2 months of recovery. The American College of Radiology strongly advises against full-body CT scans for healthy, symptom-free adults. If you have real symptoms, unexplained weight loss, chronic cough, or pain, targeted imaging is appropriate. Otherwise, the radiation risk far outweighs any potential benefit. The bigger picture, when less is more. These 5 tests, bone scans, brain MRIs, stress tests, colonoscopies, and full-body CTs, can be useful for some, but for many seniors, they create more harm than help. Modern medicine is powerful, but more testing doesn't always mean better health. In fact, overdiagnosis can steal peace of mind, independence, and even years of life. Before agreeing to any test, always ask your doctor 3 questions. What are the risks and benefits for someone my age? What happens if the test finds something? Will the result actually change my treatment? If the answers aren't clear, it's okay to pause. True prevention isn't about chasing every test. It's about maintaining balance. Eat well, move daily, sleep deeply, and manage stress. Your health after 70 isn't about doing more. It's about doing what matters most. Now, we'd love to hear from you. Have you or someone you love ever had a test or treatment that turned out unnecessary? What did you learn from it? Share your story in the comments. Your experience could help someone else make a smarter health choice. Thanks for watching, and remember, staying informed is the most powerful medicine of all.